Good afternoon, everyone, and welcome to our World Rabies Day webinar. My name is Lauren Card, and I am the Programs Director for the Canadian Animal Health Institute. I am thrilled to once again be your moderator for today's event. I would like to take the time to acknowledge that today I am speaking to you from Kitchener, Ontario, which is the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples. We recognize our responsibility to serve as stewards for the land and honor the original caretakers who came before us. Communities across Canada are enriched by the enduring knowledge and deep-rooted traditions of the diverse First Nations, Métis, and Inuit today. I would also like to acknowledge the generosity of our sponsors. Without the financial support of Boehringer Ingelheim and SIVA, this webinar would not be possible. We would ask that participants remain muted throughout the webinar to reduce background noise. At the end of the webinar, our presenters will address audience questions. You can anonymously ask questions at any time by typing your question in the Ask a Question box. If you encounter any technical difficulties, please click on the technical support button on the top right of your screen. For those who would prefer to listen to this webinar in French, please click the French button at the top of your screen. Each year, on September 28th, people around the globe come together to mark World Rabies Day, a day dedicated to raising awareness about one of the oldest known infectious diseases and one that is still one of the deadliest. Rabies is responsible for 70,000 deaths each year, almost all of them preventable through vaccination, education, and timely access to treatment. Here in Canada, we are fortunate to have made enormous progress in protecting both people and animals from rabies. Through strong surveillance programs, wildlife vaccination initiatives, responsible pet ownership, and cross-sector collaboration, human rabies cases are exceedingly rare. But rabies continues to circulate in our wildlife populations. That is why continued vigilance is so important. This year's theme, Strengthening Canada's Rabies Defense, reflects that commitment. Rabies prevention is not the responsibility of any one group. It is a collaborative effort between veterinarians, physicians, public health officials, wildlife experts, researchers, and communities. The importance of public awareness in rabies prevention and prompt treatment also cannot be understated. Today, you'll hear from leading experts, Tor Buchanan and Dr. Erica Sims, who will share updates on Canada's rabies situation, highlight new prevention strategies, and discuss how we can all play a role in controlling this important disease. It is my pleasure to introduce our first speaker, Tor Buchanan. He is the coordinator for wildlife research and monitoring with the Ontario Ministry of Natural Resources Wildlife Research and Monitoring Section based at Trent University in Peterborough, Ontario. Tor is a dedicated scientist whose work focuses on the ecology and control of wildlife rabies, particularly rabies in raccoons and foxes in Ontario. Tor has over 25 years' experience in disease monitoring projects and brings a wealth of expertise in wildlife surveillance, oral rabies vaccination, and adaptive management of rabies outbreaks. We're delighted to have him here today to speak about fox rabies management in Northern Ontario. Welcome, Tor.
Thank you, Lauren. I'm pleased to be here today to speak to you about fox rabies in Ontario. Here in the Ontario Ministry of Natural Resources, we do manage wildlife rabies with the ultimate goal of eliminating certain variants of rabies from Ontario. Today, I'll be speaking primarily about one variant of rabies in Ontario, the Arctic fox variant of rabies, and particularly focusing on the history in Southern Ontario. Excitingly, I'll be presenting evidence today that this variant has recently been eliminated from Southern Ontario. So just a quick recap. I'm assuming this audience has a pretty good understanding of the fundamentals of rabies virus, but I'll recap its ecology in Ontario wildlife. So we have three variants of rabies that occur in Ontario. Arctic fox variant rabies, which we sometimes just call fox rabies for shorthand. Mid-Atlantic raccoon variant of rabies. That one it has come up from the US and entered into Ontario both in 1999 and again in 2015 in Hamilton. We're not going to talk about that one too much today, but it is adjacent to this story. Importantly, we also have several bat variants of rabies that occur in Ontario. And although these strains of rabies may be named after one particular species, any mammal can contract any one of these strains of rabies. So rarely and occasionally we do get a skunk with bat variant rabies, for example. Mostly they occur in the species that it's named for. So the Ministry of Natural Resources has implemented control programs to manage and eliminate terrestrial rabies, which is the fox and the raccoon variants from Ontario. This map from the Public Health Agency of Canada shows the different variants of rabies that occur across Canada. The one we're talking about today, the Arctic fox variant of rabies, is in the tan there. This type of rabies occurs across the circumpolar portions of the northern hemisphere, so across Russia, across northern Europe, and through Alaska and Canada. It is present in the Arctic fox populations in this polar region, and in some of these lower southern extremes of the area, red fox populations do overlap with Arctic fox, and we'll see some red fox in that area that also have Arctic fox variant of rabies. This also allowed Arctic fox variant rabies to travel further south into Canada. Famously, in the early 1950s, Arctic fox rabies had a large outbreak and did migrate south from the Arctic areas of Canada into more southern regions of the country. First in the Alberta and Saskatchewan, Manitoba areas in the early 1950s, and spreading from there into southern portions of those provinces and to British Columbia and through to Ontario eventually. And then on the eastern side of the country, we also had it coming south from Nunavik through the Hudson Bay shorelines and James Bay shorelines, first occurring in Ontario around Moosonee, Ontario in 1954. From there, it spread very rapidly through red fox populations into southern Ontario. And by 1956, it had spread all the way to southern Ontario, a distance of over 1,000 kilometers. And by 1958, it was well established in southern Ontario, up to 2,200 cases in 1958 in just 1 year alone. So for the rest of the presentation, I will be focused in on the southern Ontario portion of Ontario. There are very separate and interesting stories that occur in northern Ontario and far northern Ontario on our coastlines. But today's presentation is just focused in on southern Ontario, where we have large human populations and agricultural regions. So to look at the time periods between the incursion of fox strain rabies into southern Ontario in 1956 through to 1989, we did have over 21,000 cases of rabies in red foxes in southern Ontario, being the total of 49,000 cases of fox strain rabies in all types of mammals in southern Ontario during that time frame. And we used the date cutoff of 1989 as a watershed moment. Everything before that was pre-control, and rabies control programs began in 1989. So that would be post-control years. So here's a quick look at this map of the situation of rabies in Ontario before any control was established. And to look at the annual cases per year, you can see things had leveled off through the 1960s, 70s, and 80s to approximately 1,300 cases per year was their average, and an all-time high in 1986 of over 3,200 cases per year in that one particular year. It was becoming pretty clear that rabies was well established in southern Ontario, and it wasn't going to fade out on its own. There were great economical costs to living with rabies in southern Ontario. Livestock became positive with rabies and had to be put down. There were indemnification costs to that. But most importantly, there was also human costs as well. In 1959, we had 2 deaths in Ontario attributed to rabies in Port Perry and Peterborough, Ontario. And in 1967, a 4-year-old child died in the Ottawa area from rabies exposure while she was playing with her kitten. It bit and scratched her face. She did receive post-exposure treatment per the WHO guidelines, but still did succumb to rabies. That caught the media's attention and public's attention quite a bit in 1967, and it was clear by that time that rabies was going to be established in southern Ontario. Concurrently, there was also developments in science that allowed us to attempt rabies control. And money was secured starting in 1968 to attempt to control rabies in Ontario in wildlife. First of all, a lot of research had to be done before we could attempt to control rabies in broad areas of the province. We had to develop vaccines that would work at vaccinating animals, particularly through the oral route. A vaccine developed in Ontario was the ERA vaccine, and it was a live attenuated vaccine that, when eaten by certain wildlife, particularly foxes, would vaccinate them for rabies. We had to encapsulate that vaccine in a bait that would be attractive for a fox to eat. And so in this picture, you can see some different bait attractants we had tried: chicken flavor, cheese flavor, fish oil flavors, sweetened flavors, all just trying to find the right attractiveness to induce a fox to eating a bait that it would find. We also had to determine how to distribute vast quantities of baits across a vast landscape. The solution turned out to be using aircraft. We also had to develop the technology to displace all those baits out on the landscape. So you can see this machine in the bottom right, what is basically a conveyor belt that would drop the baits out of the chute of the airplane at a continuous rate. We also had to do a lot of research on the biology of the vector species, foxes and skunks mostly, to find out what their home ranges would be, their cyclical movements across the landscape, when the best time to vaccinate those animals would be, the number of baits we'd need to put out per square kilometer to effectively vaccinate the population. All that had to be developed from scratch. If we look at the next map, these are the years just prior to control: 1988, 1989, and 1990. It's a snapshot. Over 5,000 cases of rabies in those 3 years prior to control. And you can see all these dots are positive cases of rabid animals. The red rings being rabid red foxes, the black rings being rabid skunks with Arctic fox variant rabies, and the blue rings being all the other species. Most of these were cattle, dogs, cats, raccoons, and other wildlife species. But the primary species that were vectoring this outbreak were the red fox and the striped skunk. So I'm going to go through a series of maps here over the years as we attempted rabies control. And so you'll see shaded areas of the map where we put out the vaccine baits. And you'll see we generally put those baits out in the fall, maybe in October, and it will take until the next year to see results from that. So when you see baiting area in, say, 1989, you're really not going to see a result in lowered cases until the next year, say 1990. And so pay attention to that as we slip through the maps. You'll see the baiting areas, and then you'll see the impacts that has in the following years. We are missing most of the Quebec data from these maps. There are some cases shown, but there's some data missing, and that is an important part of the story as well, too. So 1989 was the first year we did rabies control cases, baiting in Eastern Ontario. That worked really well. And so by 1990, we did expand the program to include most of Eastern Ontario. We were getting good results. We were able to test the animals to see if they were eating baits based on the biomarkers in those animals, but also if they were getting vaccinated by eating those baits due to the presence of antibodies in a blood sample. We were getting good results on that, and we did expand the program. And you will see in the following years that started to have an impact on the number of cases in Eastern Ontario. You'll also see on these maps, we've tried some techniques in metropolitan areas of Hamilton and Toronto. And in these areas, we're putting baits out by hand because we couldn't fly over the dense urban areas. So by 1991, this is 2 years of baiting in Eastern Ontario. You're seeing a great reduction in cases in Eastern Ontario. And we're buoyed by that success and receiving more funding. And so we do continue to do that baiting in Eastern Ontario. You can see the reduction in cases in that area. By 1993, we've had almost a complete elimination of rabies from Eastern Ontario. And so with that, we've started to expand the program by 1993 to include Central Ontario and ramp up control and work towards that elimination. You'll also notice at the top of the map, we have the annual number of cases occurring per year. As you watch the following slides, you'll see those numbers decrease dramatically, almost by half of each year. By 1994, we've dropped down to just 600 cases of rabies, practically no cases occurring in Eastern Ontario, and starting to have some success in Central Ontario, and have expanded the program right across Southern Ontario. By 1995, that case you see in Eastern Ontario, that blue circle, was the last case of rabies we had in Eastern Ontario. So successful elimination of fox variant rabies from Eastern Ontario. By 1996, we're down to just 100 cases, down from our average of 1,300 cases per year. We've reduced the baiting in Eastern Ontario due to lack of cases in that area, and focusing in on the remaining cases in Central and Southwestern Ontario. So by 1997, there were a couple of cases occurring in Quebec, which aren't shown on this map. So we did some proactive baiting in that area to prevent rabies from coming back into Eastern Ontario. But do note on the maps, the following maps here, that we're seeing a great reduction, particularly in the red fox population. You'll see in this map that there's mostly black rings cases that are occurring in skunks, and we're practically eliminating rabies in the red fox population. The vaccine we're using at the time is the ERA vaccine. It's excellent for foxes, but it was known not to be as effective for skunks. We were hoping that by eliminating the main reservoir of rabies, being the foxes, that we could break the spread in skunks as well. By 1998, things are going really well. We have an all-time low cases in Ontario of just 48 cases. Those are typically just in skunks, and things were going great. So much so that we were actually provided an award for the Amethyst Award in Ontario, and that was for the elimination of fox strain rabies from Southern Ontario. However, that was a bit premature, and by 1999, cases actually increased again for the first time in a long time. Again, mostly still in skunks, but we were getting a continuous number of cases, and it was starting to become evident that just vaccinating the foxes alone was not going to eliminate rabies from Ontario. We also started to begin a new advancing of rabies from the far north again. Another outbreak from the far north was starting to spread back down into Northern Ontario towards Southern Ontario. You can just see above the Ontario label in this map, one blue circle above that spot. And in the following year, in 2001, a number of cases around Sudbury led us to do some more baiting in Northern Ontario there to prevent a new rabies outbreak coming from Hudson Bay down into Southern Ontario again. By 2002, we did another campaign around the Sudbury area, and that was successful in eliminating the cases from Northern Ontario in that area. By 2003, that is the last case we had in Central Ontario. That blue dot you see just above the Lake Ontario label. By 2004, we've eliminated rabies from Central Ontario, but we do still have that persistent number of rabid skunks in Southwestern Ontario. In 2005, it's a pretty similar number of cases occurring again in skunks, and it's becoming clear that rabies will not be eliminated by skunks just by vaccinating with ERA vaccine. Luckily, help was on the way. For decades prior, we had been developing a new vaccine called the ONRAB vaccine. This was a recombinant vaccine which used a human adenovirus with an inserted rabies virus glycoprotein. So it would vaccinate wildlife that would eat those, the same route the ERA vaccine worked. But it also worked very well in raccoons, which was a concern for Ontario at the time, as we had raccoon rabies spreading out from the US and did cross into Ontario in 1999. We knew the ERA vaccine was not that good in raccoons and did not work at all in skunks. This ONRAB vaccine did work well in raccoons and worked pretty well in skunks as well too. So this is what we hedged our bets on. It worked very well in red foxes as well. We did have to develop a new bait as well too. The old bait was quite a bit larger and was targeted towards red foxes. The new bait, called the ultralight bait, was quite a bit smaller, and it was targeted for skunks, really. That small animal like a skunk and a small mouth would be able to chew on this bait and vaccinate itself. So the on-rab vaccine in the new bait was our hope to eliminate the final residuals of fox rabies in skunk populations. 2006 was the first trials of the on-rab vaccine in the field. We'd had really good experimental trials in the lab, but this was the first time we put the vaccine out on the ground. That's the orange shaded areas. 2007, we had good results in 2006 from that serology that we had experimented with in 2006. So the distribution of on-rab was ramped up in 2007. In 2008, almost the entire area was covered with the on-rab vaccine. And again, we're still getting really good results in foxes and now in skunks as well too. 2009 was the last time we used the ERA vaccine. We did put out quite a bit of vaccine. It was evident that we were going to make the switch over to on-rab, so we had to use up our remaining stocks of ERA vaccine. But the important areas were covered with on-rab vaccine. By 2010, the cases are being quite greatly reduced, down to 10 cases, all in skunks and all in the on-rab area. Down to 2 cases by 2011. And the last cases in southern Ontario were in 2012 in a cat and a skunk. In 2013, we continued to vaccinate that area. We know that surveillance is not perfect and there could still be cases occurring. So we did vaccinate an area based on the last cases we had. We also had a case up on James Bay coastline up in Saskatchewan as well too. But no cases in southern Ontario. And by 2014, by the fall of 2014, it had been 2 years since we had a case. So we actually withdrew all the baiting from that area. And we were wondering if rabies was gone from southern Ontario. The World Health Organization guidelines stipulate you need to be 2 years, a jurisdiction needs to be rabies free for 2 years with adequate surveillance. The wiggle word there is adequate surveillance, and nobody really knows what that means. Evidently, the surveillance we had done at that time was not adequate because rabies was detected the following year in 2015. Right at the very end of the year, December 30th, we did detect a rabid cow in southwestern Ontario. We had done some whole genomic sequencing on that case, which proved it was genetically related to the last cases we had in that area. It wasn't a new outbreak that spread from the north. It was a continuation of the previous outbreak. So by 2016, the following year, once the season had warmed up and we could get baits on the ground, we did put some on-rab vaccine around that area. Concurrently in 2015, we also had an outbreak of raccoon strain rabies in Hamilton, Ontario. So it was a much larger outbreak and more intense outbreak, and most of our efforts were focused in on the Hamilton outbreak in raccoons. There was a shortage of vaccine available that year, and most of what we had went towards the raccoon outbreak, preventing it from spreading to Toronto. What we had left, we were able to put down in the fox areas there to cover those cases. By 2017, the vaccine shortage had been solved. We were able to get all the vaccine we needed and put out on-rab baits all around the cases we had in 2017. The few dots that you see just outside to the south of the baiting area were being covered by the raccoon on-rab baiting as well. By 2018, we had the 7 cases, and this turned out to be the last year we had cases of fox rabies in southern Ontario. So December 4th of 2018 was the last case that we had registered. 2019, we continued to bait that area, knowing that surveillance wasn't perfect, and we wanted to make sure that something wasn't brewing undetected in that area. But no cases in 2019. No cases in 2020. Again, we continued to put some baits down in that area just to be safe. And by 2021, we had no cases, and it had been well over 2 years since we had the last case. We withdrew all baiting from the fox area of Ontario. And this map would look the same for 2022, 2023, 2024, and 2025. So here's a graph of the cases we've had in Ontario starting at the very beginning in 1954. The orange arrow denotes the beginning of the control program in 1989. Great reduction using the ERA vaccine in the fox population, but leveling off at low numbers of cases after the mid-1990s, between 100 cases. By 2006, the first advent of ONRAB going in the field reduced cases further, with no cases being detected by 2013. And that small resurgence in southwestern Ontario in 2015 led to approximately 10 cases per year for a few years, with the last case being in 2018. So has rabies been eliminated from southern Ontario? We think so. We've just prepared and submitted a scientific peer-reviewed publication. It was just accepted this week in the Facets Journal. We're hoping that might come out in the next couple of weeks, but it does present this evidence in peer-reviewed paper. The main parts of the paper, the main arguments are that the last case was almost 7 years ago now. We've had very consistent screening of wildlife, which was much greater than it was back in 2012, 13, and 14 when we didn't detect cases. And having the space in a journal like this, in a discussion section of that journal, we're able to instill some very careful messaging, which I'm sharing along today too, is that we don't want the tagline to the public being rabies has been eliminated from Ontario, because that's far from the truth. We've eliminated one particular variant of rabies from one area of Ontario. We still have raccoon rabies threat in St. Catharines, Ontario presently, although it's been 2 years since we've had a case of that as well. We still have Arctic variant rabies in far northern Ontario. It is endemic across the Hudson Bay and James Bay shorelines. It's endemic to that area. We could have translocation events from far north. That did happen in Montreal a couple years ago. A dog was transported down from the northern coast to Montreal, and it did have Arctic variant rabies. So human translocation can happen. And very importantly, we do still have multiple variants of bat strain rabies across Ontario. And tragically, in 2024, a young Ontario child died from a bat strain case of rabies, the first fatality we've had in Ontario since 1967. Part of that evidence that we present in the paper is this map, the bulk of surveillance that we've done since the last case in 2018. Historically, 3 species have made up the vast majority of cases in Ontario. Red fox, striped skunk, and cattle have made up 83% of all cases of Arctic fox variants rabies in southern Ontario. So these are high-value surveillance samples. Since 2018 to December 2024, we've tested 1,400 skunks from that area, and these are skunks that are acting sick, were found as roadkill, or found dead. And so those are high value samples to test for rabies. We've tested 1,400 skunks. We've only been able to test 86 red fox from that area, but those are important, very important samples to test. And we've tested 55 cattle from that area as well too. Kind of less importantly, for fox variant rabies is the raccoon. It's a secondary vector species for this outbreak. We've tested over 5,000 raccoon samples from that area. There is a lot of overlap with the raccoon outbreak that's going on at the same time in Hamilton and St. Catharines. So most of those samples are collected for the surveillance of raccoon variant rabies, but they do add some more weight that fox variant rabies is not circulating in that area. So the impact of fox rabies in Ontario is pretty big. We had over 30 years of baiting from 1989 to 2020. There was a couple years in 2014-15 that we didn't bait, but 30 years of management to get to where we are today. 16 million ERA baits were distributed across the landscape over that time, and 4.9 million ONRAB baits. We were very close to elimination in 1996, well under 100 cases, and we thought it was practically done by 1996. Instead, it did go into the skunk population, which we couldn't vaccinate very well. And we had another 22 years of outbreak because it didn't quite snuff out in 1996. One thing that we know is surveillance is very critical. It was throughout these 30 years to allow us to do the right management in the right place. And it's going to be critical coming into the future as well, too, to make sure that rabies truly is gone from that area and doesn't come back into southern Ontario. So next for us, we do need to keep working on that raccoon variant elimination from Ontario, and we are getting closer to that. We're going to continue on the research programs to make sure we have the right tools and the right surveillance techniques to early detect new outbreaks of fox variant rabies. And we need to do a better job at doing surveillance in southern Ontario and northern Ontario for early detection of new outbreaks and readiness if there is new outbreaks. This was a very large effort over 30 years, literally thousands of people involved in a program from all different ministries and agencies and members of the public and partners across Canada and the US as well too. We've selected a couple of the highly involved names for acknowledgements in our research paper, but the list is truly epic and very much a group effort across North America to get to this point. With that, I'd like to thank you for your attention and be ready for any questions at the end of the seminar today. Thank you.
Tor, for that really great presentation. I'm now happy to introduce our next speaker, Dr. Erica Sims. Dr. Sims was born and raised in Regina, Saskatchewan. She completed her Doctor of Veterinary Medicine at the Western College of Veterinary Medicine in 2016 and went into companion animal practice in Regina following graduation. A strong interest in public health brought Dr. Sims back to the WCVM in the fall of 2019 to pursue a Master of Science in Epidemiology. Her research focused specifically on canine zoonosis and companion animal surveillance in the prairie provinces. Dr. Sims participates in northern spay and neuter and veterinary wellness clinics in northern Saskatchewan every year with the Western College of Veterinary Medicine Services Learning Group. She has strong interests in zoonotic and infectious diseases, public health, disease outbreak investigation, and surveillance. Dr. Sims started as the animal health veterinarian with the Ministry of Agriculture in March of 2022. In this role, she primarily works on chronic wasting disease management, One Health initiatives, including how to improve rabies vaccine access for companion animals in remote communities, education and outreach, disease surveillance, and animal welfare in the province of Saskatchewan. I am pleased to welcome Dr. Erica Sims to share her valuable insights on the Community Vaccinator program in Northern Saskatchewan.
Awesome. Thank you so much for that lovely introduction. So excited to be here today. I always love an opportunity to talk about community vaccinator programming. This is something that's near and dear to my heart. So with that, I'll kind of just get started on sort of the background of community vaccination and what our pilot in Saskatchewan is looking like at the moment. Before I get started, though, I do want to do my own land acknowledgement. So I'm calling in from Treaty 4 territory today, the original lands of the Cree, Ojibwe, Saulteaux, Dakota, Nakota, Lakota, and Métis peoples. I pay my respect to the Indigenous and Métis ancestors of this place and reaffirm our relationship with one another in the spirit of reconciliation and collaboration. So we've gotten a pretty good overview of rabies in general, but I do always just like to touch on rabies as a One Health problem and where companion animal rabies vaccines can come into play as a preventative tool. Before we'll look at what is community vaccination, benefits of this type of programming, what kind of rules and regulations are around this, and jurisdictional considerations, as well as some other factors. Before we look at kind of what we've been working on here in Saskatchewan, specifically with our community vaccinator pilot, I'll walk you through our program model, updates on the program, and sort of evaluating the program and kind of future considerations where we hope to see this go. So we've already gotten a really good overview on rabies with both our introduction and prior presentation, but this is a viral disease, infects mammals, including people, transmitted through bites and scratches. We've gotten a really good overview of our wildlife rabies reservoirs. So foxes, skunks, raccoons, bats, these are all variants present in Canada. Once symptoms appear, there is no treatment. This is a fatal disease. And I always like to highlight a couple of clinical signs that we can see in our dog and cat population. So hypersalivation, difficulties drinking, swallowing, aggression to people or objects. You might see acute behavioral changes, nervousness, vocalization, or in more advanced stages, pretty significant neurological signs, paralysis. and those sorts of things. So rabies is a really great One Health example where we're talking about how it impacts human health, animal health, and the health of our environment or our ecosystems. I like to bring up the definition from the World Health Organization, an integrated, unifying approach to balance and optimize the health of people and animals and the environment. It's very obvious how rabies can impact human health and animal health and how there can be, transmission from animals to people. But I also think it's really important to highlight those environmental aspects. And our prior presentation kind of touched on this too already, but climate change is definitely impacting population dynamics and habitat ranges. And the fox population is one that I like to bring up as a really good example that the habitat range of Arctic foxes is definitely being impacted by climate change. So this provides kind of unique opportunities or more opportunities for sort of interfaces with wildlife, domestic animals, and then people as well, particularly in northern parts of our province and other parts of Canada, where we've got free roaming dogs within communities. That puts them at an increased risk of kind of that interface between wildlife and our companion animal species, and then that transmission of rabies potentially occurring. So companion animal rabies vaccines are just one tool that we can be using to protect our animal health populations. This in turn also protects public health and our human health. So we know companion animal rabies vaccines are an effective intervention to reduce that risk of transmission with all of those pieces, from the kind of companion animal side to human transmission risk, where those companion animals might be in contact with wildlife. But the thing I want to highlight with this is accessibility around companion animal rabies vaccines, because there are certainly areas of our province and across Canada that don't have easy access to this preventative tool. So that's kind of where community vaccination comes into play. So what is a community vaccinator? This concept, allows for the delivery of vaccines to cats and dogs, including rabies vaccines, from someone other than a veterinarian, such as a member of the community who has completed specific training within the jurisdiction that they're potentially working in. This is to address veterinary access gaps in areas of the province without readily available care, compounded by a national veterinary workforce shortage. So I'd like to highlight that this has become a national priority for the Chief Council of Veterinary Officers. And one thing I'd just like to bring up as well is that you might hear kind of interchangeably the use of lay vaccinator versus community vaccinator. We are kind of drifting away from the term lay vaccinator, just to kind of make it more appropriate if there are different types of professionals maybe fulfilling this role. A little bit better terminology to use community vaccinator. And now I know there's a lot of text on this slide, but I do like to go through kind of the benefits of community vaccinator programming because this is really important. So, kind of the most obvious one being that this prevents diseases that threaten animal health and human health and improves health outcomes. It improves access to basic veterinary preventatives, particularly in historically excluded communities that lack ready access. It allows for opportunities for Indigenous engagement, improved relations and education. So in addition to, talking about rabies, this is an opportunity to talk about dog bites, other vaccines. It promotes the veterinary profession, animal welfare, public health, and other zoonoses that can be implicated with domestic animals just in general. It takes some of that burden off of veterinarians to fill these gaps in remote areas, especially during an active veterinary workforce shortage. It helps to protect that human-animal bond, which is extremely important. Strengthens a community's ability to self-govern and their capacity for self-determination. It enables knowledge sharing on topics such as zoonotic diseases, First Nations, Métis, and Inuit culture, and reconciliation. And this is a big one for me, that it acts as a proactive and preventative tool rather than a reactionary approach, especially in that, rapidly changing environmental climate that we talked about, with wildlife population dynamics changing. Our prior presentation showed that really nice map of Canada with some of those habitat ranges. And for me in particular, obviously sitting in Saskatchewan, that northern part where the Arctic fox population is kind of starting to move down. That's where, I see some potential challenges for us. We're really fortunate in Saskatchewan that we, currently don't have cases of Arctic fox rabies. We're endemic for bat rabies, but we're kind of surrounded by it on multiple sides. So I see this as an opportunity to be proactive versus reacting to a problem after it occurs. There are a lot of rules and regulations around procuring rabies vaccines in veterinary medicine. So just to touch on this really quickly, there are federal requirements. There's also provincial legislation and provincial bylaws that might come into play. Rabies vaccines are regulated by the Canadian Centre for Veterinary Biologics through the CFIA. And so there are rules, around the distribution, sale, and who can administer rabies vaccines. But there is a federal exemption under the Health of Animals Act for remote communities. And within this exemption, a community is eligible to procure rabies vaccines directly from a rabies manufacturer if they are considered remote, have a trained lay vaccinator, and have cold chain storage. So I've underlined trained lay vaccinator because a gap that we're trying to fill with our own program is it's great that this exemption is in place, but how are individuals within communities getting trained to then access this exemption? A couple of other jurisdictional considerations. So there needs to be necessary infrastructure for success, longevity, and expansion of community vaccinator programming. There does have to be a degree of veterinary oversight, especially for the training. So that gap that I'm talking about and a certification process to kind of meet a certain standard, considering certain provincial legislation, what provincial bylaws might be in place through a veterinary medical association. If the jurisdiction does have one, there are some provinces that don't have their own VMA. So these are things that might come into play in different parts of Canada and how to kind of create your own programming. And then there's obviously a lot of collaboration between multiple agencies and rights holders. Some other considerations and why this is not simple to implement. So considerations around animal handling experience for an individual who might fulfill a community vaccinator role. What other equipment is needed? What facilities? That training piece is obviously a big proponent. Standardizing it across a jurisdiction so that everybody gets the same type of training. What geographical challenges might come into place in terms of actually facilitating training. Procuring rabies vaccines, so coordinating with a rabies manufacturer has to be a consideration. Shipping, vaccine cold chain storage, animal identification and record keeping, all really important, as well as some of those other public health components. So does the community vaccinator need to receive their own rabies series? What about ongoing titers? What about a potential risk, working with companion animals, so dog and cat bites, needle stick injury, just general domestic animal contact and those other zoonoses, biohazards and sharps, etc. And cost and liability is obviously something that has to be part of the conversation. We'll talk a little bit about this more later. And then, delivery of other core vaccines. Can this be included in this type of programming? So we'll kind of dive in now to sort of what we've been working on here in Saskatchewan as an example, and we'll look at our program model. And the first thing we kind of had to set up and do is define what we're talking about. So again, a lot of text on this slide. I won't go through all of these definitions in any great detail, but we need to, talk about, well, who is eligible, what is eligible, who can deliver this training. So we did set out definitions for all of these pieces. So when we're talking about who can actually receive these vaccines, what is our definition for companion animal? With our program, this is very specific to dogs and cats. And that it can be, of an individual resident or Saskatchewan community if we're talking about outdoor and free roaming dogs who maybe don't have individual ownership, but are more so community ownership. When we define who can actually administer the training, our terminology for this is a supervising veterinarian, so that licensed to practice in the province of Saskatchewan with good standing. We do also recommend that they undergo truth and reconciliation training. We have to define community vaccinators, so who can actually fulfill this role. So this is any individual Saskatchewan resident living within or having an established relationship with the corresponding eligible community. They have animal handling experience that is certainly very useful, and that they've received the training through our office. We also need to define how a community is eligible. So an eligible community is any community in Saskatchewan considered to have limited or no access to veterinary services at the discretion of the Office of the Chief Veterinary Officer and in good faith. When we're talking about community, we're referring to a geographical unit. So an individual Saskatchewan resident couldn't just apply for this training, in rural Saskatchewan. It has to be a community-based approach. And you'll notice our definition is quite vague on purpose. This is intentional because it's actually really difficult to define remote. And what we didn't want to do was inadvertently exclude communities who could benefit from this type of programming. So, are we talking about distance from an urban center? Well, what types of transportation methods are even available to people? You might be an hour away from a major city, but can you actually get to those veterinary services? Are we talking about, only certain parts of the province, population size? So it can actually get really complicated really quickly. And I encourage people to maybe think about how they would define remote kind of in their own roles. But that's why we kind of landed on this very broad definition. And we work very closely with the Saskatchewan Veterinary Medical Association as well when we get applications in from community in terms of, establishing if they're a good fit to receive the training. So this is kind of the overall model we've landed on, and I'll kind of walk through each of these pieces. But starting at the top, we're talking about an agency-led program. So there has to be, program development and a strategy in place so that we can standardize a training program and develop resource material. The agency, so in our case, our office maintains active community vaccinator lists. We perform annual auditing and recertification for individuals. And then also that community engagement piece kind of falls within that part of the model with other agency involvement as well. That's really important. So kind of once that foundation is in place, then we move on to interested communities applying for the training. So a community can nominate a member to fulfill that community vaccinator role. We verify their eligibility and that they have cold chain storage before we move into our training process. So we then deliver the training. This includes written material, a classroom session, as well as a hands-on component followed by an examination before they can be certified by our office as a community vaccinator. But once that piece happens, then they're eligible for that federal rabies vaccine exemption that I talked about earlier. So this is CFIA Form 5977 that allows for them to procure their own rabies vaccines directly from the manufacturer. And then it falls into the community's hands. The community becomes responsible for ordering rabies vaccines and maintaining appropriate cold chain storage. The community vaccinator administers rabies vaccines to dogs and cats in the community and maintains all those records. And then it kind of cycles back up to the top where we've got that overarching oversight. So that annual auditing piece, then new communities may be coming in with applications. And then it's kind of that continued cycle. So our mandate with our program is to reduce the risk of rabies in companion animals, dogs and cats, as I mentioned earlier, in remote Saskatchewan communities with limited to no access to veterinary services to improve domestic animal health and public health outcomes from a One Health perspective. So our objectives are to reduce the risk of rabies in domestic animals and people by increasing companion animal rabies vaccine access to remote and historically excluded communities in Saskatchewan, by training and utilizing community vaccinators within enrolled communities to vaccinate cats and dogs directly. And the really, really important piece with this is that we want to create a model that leads to sustainable and community-driven community vaccinator programming. So the community really being at the forefront of this, kind of driving their own ship and taking the lead in how they want to be, vaccinating animals within their community. I do like to highlight that this involves a lot of collaboration between several agencies. So our office at the Ministry of Agriculture and the Chief Veterinary Office, as well as our Indigenous Engagement Unit, is kind of at the forefront of this. But we also have many conversations with Indigenous Services Canada, Northern Intertribal Health Authority, Ministry of Health. We're collaborating very closely with the Western College of Veterinary Medicine, in specific, Dr. Jordan Woodsworth and her team, as well as the Saskatchewan Veterinary Medical Association. We're working with Zoetis as our rabies vaccine manufacturer, and then obviously conversations as well with the Canadian Centre for Veterinary Biologics. So I just like to kind of show this slide, that this isn't kind of a one person success story. Like you'd have to involve several different parties to kind of work out all the logistics on how do we actually make something like this happen. So many, many people involved. So in terms of our pilot, we kind of divided this into two phases. So phase one, really focusing on that training piece. So we developed a formal training process and all our training material and resources. So that standardization of a program in 2023. Then this went out in 2024 and underwent an external review with all our stakeholder agencies that I showed on the previous slide. And I'm not going to go through all of this, but I do like to kind of show a table of contents of our training manual, just to kind of show and highlight sort of all the pieces that go into kind of the material that we're providing to our community vaccinators. So this is part of their training. But in addition, this can be an ongoing resource manual for them, so they can go back and look at things if they need to. But we really wanted to be super detailed with this because we want community vaccinators to feel supported, feel like they have the information at their fingertips. We kind of wrote our training manual under the assumption that somebody has zero animal handling experience, zero vaccine administration experience, so that the information is there for them should they need it. So we've got several chapters in this thing, an introductory chapter on rabies and just community vaccination in general, a whole chapter on animal handling, then obviously a chapter on vaccination, record keeping, community vaccinator safety and public health being extremely important, including social safety in there. We have a whole chapter on cost and liability, what their evaluation and examination looks like, as well as the certification process, and then kind of a summary and conclusions. There's a frequently asked question section in there, and then some additional resources. So some of these are templates that the community vaccinator will use for their own use, but then some external resources as well. So very broad kind of scope here with our training material that I just kind of like to highlight what went into our training manual without having to show you the whole training manual. A couple of other components here with the training that I just want to touch on. So our community vaccinators are required to read the training manual and understand its contents. We do go through a classroom session, and their hands-on training component is a minimum of 4 hours of hands-on training. I'll talk about how we're doing that in just a moment. And then they have to pass a hands-on evaluation following that hands-on training, as well as a written or oral examination in which they have to receive greater than 75%. Again, this just helps to kind of standardize the program, make sure we're sort of meeting expectations when it comes to our veterinary medical associations, the Chief Council of Vet Offices, and the Canadian Veterinary Medical Association as well, that these people are indeed equipped to be vaccinating dogs and cats within their community, not being a veterinarian. So in terms of kind of phase one in training moving forward, we did launch our training pilot in April of this year in collaboration with the Western College of Veterinary Medicine. So we delivered the hands-on component in conjunction with 3 WCVM clinics in 3 different communities this spring. This was followed up by a virtual classroom session that was provided in July 2025. And then individual examinations have been administered. So we officially have 3 community vaccinators who are currently certified by our office. And this leads to me to kind of where we are at right now. So we're just kind of initiating phase 2 of our pilot, which is going to be vaccine ordering and then ongoing administration. So thinking about shipping and logistical considerations, that's been a priority for me. I've been dealing with that for a long time already. So we've got some of those pieces worked out, including a central shipping location and then working with public health partners to deliver to communities. And then it'll be about community vaccinators administering vaccines in their community and managing their records. So what are some of the challenges associated with this? Obviously, cost is a big one. So it is the responsibility of the community to pay for the vaccines and any equipment related to this type of programming. Again, this comes back to a community-driven approach. It's also an important factor when we talk about responsible animal ownership. It gives them an opportunity to kind of drive what they need within the program, but that is still a limitation for communities for sure. There are other costs associated with the agency oversight, so staff costs, resource development, all of those pieces. And when we talk about a rabies series and ongoing rabies titers for a community vaccinator, there's a cost associated with that as well. So working with public health counterparts where we can in terms of facilitating some of those things and maybe reducing the costs. Liability is obviously another really important piece. So we've got a ton of consent and liability waivers in place. But vaccine reactions is always a question I get. Well, what happens, if you're working with a community vaccinator in a community and they have a vaccine reaction? This is all part of their training as well. Vaccine reactions are inherently very rare, but not impossible. And at the end of the day, serious reactions would still need to be referred to a nearest veterinarian, which for some of these communities is going to be still very challenging to access. So not a 100% bulletproof tool by any means, but kind of the reality of the situation and weighing pros versus cons, and an individual owner or community member, having all the information about vaccine reactions before vaccinating their animal and being comfortable with that. So just really quickly, we will be evaluating our pilot kind of over the next 6 months. What worked well, what needs to potentially be adjusted, or what's not working at all. Getting feedback from our community vaccinators directly and any partners involved. But our ultimate goal is to, continue to expand this in other communities. We will probably do maybe a second cohort in collaboration with the Western College this coming spring. But that's kind of where things are sitting right now. So I'll stop there and would be happy to take any questions.
Thank you so much, Erica. Such an amazing program. To everybody out there, I realize we are at the top of the hour, but we will continue for a few minutes because we have received some questions, and so we'd like to address those. So the first question that we have, Tor, this is actually for you. The question is, can you please comment on how the 5 cases of rabid foxes in the remote Northern Ontario impacted Indigenous community members and their dogs?
Yeah, we did have 5 cases this year, so kind of similar to Quebec. They had a bit of an outbreak, an eruption of cases this year along Hudson Bay, James Bay. More in red foxes in Ontario and more in Arctic foxes in Quebec. But those were detected this spring in several different communities in that area. I think some of the challenges that Erica just overviewed are very true in Ontario as well too. Those challenges all exist in Ontario as well too. So we do need to make some efforts to implement some of the programs that Erica just mentioned there and try to get at vaccinating some of those community dogs up there. Wildlife control in the endemic areas of that area of the province are going to be really tricky and pretty much not feasible. I think the best way forward to protect those communities is through vaccinating those dogs with intramuscular vaccinations like Dr. Sims mentioned in that last presentation.
Great, thank you. Another question that we have, and I'll pose this to both of you. The question actually is, why do so many cows get rabies? And maybe we could even expand on that to dive into why it tends to be raccoons, skunks, foxes. Why is it kind of restricted to those mammals when we know that it can affect any mammals as well as humans?
I'd be curious to hear Erica's thoughts on this as well too, being a vet. But my experience in Ontario is I guess hearsay is that cattle are pretty inquisitive, and if a rabid skunk or fox would wander through the field, cows are pretty interested in checking that out. So Yeah, it is the third most common species in Ontario with fox strain rabies that we've seen. And that has been a challenge for us because not all cattle are vaccinated in Ontario, but they are a bit of a common vector species.
Yeah, just to kind of elaborate a little bit more on sort of the what we see in Saskatchewan. So we don't see very many cases in domestic cattle. We're endemic for bat rabies here. We've historically seen skunk rabies as well, though I don't think we've had cases recently. So just, that opportunity between domestic animals and wildlife, right? Livestock can be exposed to these things the same way that domestic dogs or cats could be as well. So yeah, just that opportunity there exists for contact with wildlife, and especially with bats. Um, you're not gonna see a bat bite or scratch. They're just impossible to see. So yeah, just that opportunity does exist. So.
Thank you. Next question is wondering if you can comment on low-cost rabies clinics for dogs and cats in Southern Ontario and whether you feel they are helpful.
Yeah, I think they were a very important part of that. As I mentioned, the main species were wildlife vectors, but the human risk is really that mediating species like the dog or the cat bringing rabies in from a field into the house. And so to protect people, that really is critical that those companion animals get vaccinated. So it doesn't really factor a whole lot into the landscape approach to removing rabies in a wildlife species, but it's critical in protecting the people during that outbreak.
Great, thank you. I think this next one, Erica, is for you. And it's how do we encourage more VMAs to start a program in other provinces?
Yeah, so I'll touch a little bit on kind of the Canadian Council for Veterinary Officers perspective. We do have a rabies subcommittee group that I sit on, so that's an opportunity for vets across multiple jurisdictions, at least at the provincial level, to have conversations around rabies. So it's a really good table to sit at to see, well, what's happening in other jurisdictions, and then kind of, not reinventing the wheel in your own jurisdiction. So I see community vaccinator programs kind of expanding across Canada. Manitoba launched their program last year. Quebec has had a program in place for several years. In our territories, they have to approach rabies in a more unique way because access to care is extremely limited in northern parts of Canada. So there are some examples already, and with our kind of pilot coming forward too, I do think more jurisdictions are going to become involved and kind of follow suit. At least that's my hope. And just a bit of a plug as well, we've been working on a national guidance document for community vaccinator programming that should be publicly available on the CCVO website very soon. It's just undergoing its French translation. So jurisdictions, other agencies can have access to that resource as well when thinking about some of these programs.
Great, thank you. And Eric, I think this next question is probably more suited to you, but Tor, possibly you as well. It has to do with anti-vaxxers, and the question is, have either of you run into any of this with your programs?
I'll speak first. And so, well, we're really lucky here in Saskatchewan that we have access to the Western College of Veterinary Medicine, and Dr. Jordan Woodsworth has done a ton of work with Indigenous engagement and working with communities. So that foundation has already been laid for us there. So we've gotten a lot of interest directly from communities in being part of the pilot and receiving the training. So from a community perspective, I haven't seen this. In clinical practice, I guess the people who are coming to see the veterinarian are, usually open to vaccines. So I haven't encountered it that much on my side.
We do a little bit. We put millions of vaccine baits out across the landscape. They have a 1-800 phone number on them. So if somebody finds one on their property, we may get calls to that 1-800 number to complain about that. And we hear their theories about anti-vaccine sometimes too. So it hasn't really affected the program. There's potential for it too. But yeah, we can tell that there is some of that sentiment out there.
The next question is what can Ontario farmers do to help prevent rabies spread in the rural community? What would be your advice?
Yeah. So if rabies is truly gone from Southern Ontario, we just need to be vigilant in surveillance to make sure that if it ever does show up again, we can react quickly with the tools that we have now. So surveillance is the most important thing at this time. And if anyone notices animals with those signs that Dr. Sims mentioned in her presentation, we'd certainly love to hear about it. And we have reporting 1-800 phone numbers and websites and social media. We'd love to hear about sick acting animals that we can get tested.
Thank you. Another question. This is a kind of an interesting concept. They say, is rabies is a human health hazard? Do you think that government should be paying for vaccines for people that may not be able to afford to vaccinate their animals?
So, really good question. And I maybe don't have the best response. I would love to say yes. There's always like a limit in kind of the resources that are available. So when we talk about um, kind of human health risk and potential exposure after like a dog bite or maybe um, interaction with wildlife. Our Ministry of Health does cover rabies post-exposure for that individual, but in terms of some of these preventative tools we talk about on the companion animal side, anyways, we're not quite there yet in terms of at least provincial government contributing to the cost of those vaccines. I will say, I do think it's kind of a double-edged sword where communities being able to kind of have their own say in how these things go includes kind of paying for the vaccines directly. We've seen that with responsible animal ownership and animal welfare related issues as well, that when there's a cost associated with things like vaccines or an examination from a veterinarian, that can improve animal welfare. But also if there's funding involved in some of these things and then there's opportunity for funding to then be taken away, then the whole program goes away. So I'm trying to, in my own learning, find a balance where how do we support and move these things forward and, improve resources, which might include funding, but also still allow communities to be completely in control of how they are utilizing these tools. So it's not a great answer, but I don't have all the answers or the solutions on that, but it can become quite complicated quite quickly. So,
Mhm.
I thought that was a very good answer.
thanks.
Thank you. Okay, another question. Has the SMA considered connecting with the Saskatchewan Veterinary Technician Association to recruit vet techs to assist with the training of community vaccinators?
Yes, I love this question. So, absolutely, registered vet techs would be, a great resource to improving, access to rabies vaccines and other companion animal vaccines in communities. So they kind of fall in a different lane, like they wouldn't fall within our community vaccinator programming. But there are other bylaws in place through our Veterinary Medical Association in terms of what, techs can and cannot do. So some of those bylaws need to be looked at a little bit more closely to kind of increase sort of maybe the scope of what techs can do without the direct supervision of a veterinarian. They are highly trained individuals. They can absolutely administer vaccines on their own. So I would like to see them become more involved in something like this. But the other piece I always bring up is where we have a shortage of veterinarians. We also have a shortage of veterinary technologists. So it doesn't necessarily completely solve the problem with, availability and being able to go out to communities. So having a member of the community living within the community being trained to administer vaccines, I think is still very, very crucial. But like, yeah, let's absolutely use kind of all the tools that we have where possible. But it would need to be somebody who maybe frequents these communities on a regular basis, already has an established relationship with the community. It doesn't completely solve the problem by itself because we also need more technicians too. So.
Great. Great. So, final question for both of you. We have had some huge success in eliminating rabies and really controlling this disease in Canada. Do you see this disease being eradicated in the future in Canada and possibly globally? And what would we need to see to make that happen?
I could say that I don't see it being eradicated from the planet at all. It's a serious problem across the globe, in all continents of the planet. It's not economical or technically feasible right now to eliminate all variants from all areas. So no, I don't see that happening.
Yeah, I would echo what Tor has said, and he touched on it earlier too. Like surveillance is absolutely a crucial tool, but you're not going to catch every animal that is, potentially exposed to rabies. And it's all of these different pieces, like wildlife vaccination is one component, community vaccination is one component, and getting our domestic animals vaccinated, and then, the whole human health side as well. So it involves a lot of moving parts. And I think we're in a privileged position in Canada where we have access to certain tools that definitely reduce kind of the risk. But yeah, I don't know how you get rid of bat rabies anytime soon across Canada either. So yeah, I would echo what Tor has said. Probably not.
Great. Thank you both so much. This brings us to the end of our webinar. It will be available on YouTube and all registrants will be sent a link. So thank you again to our presenters, Tor and Erica, to our sponsors, Boehringer Ingelheim and SIBA, and to everyone in the audience who took the time to join us today.